Hi, I'm Kirsten, and I'm here with Molly English, who is our director of the PCU and ICU, and today we're talking a little bit about the opioid epidemic and how it's impacted us here in the Valley. Can you tell us a little bit more?
Sure. I think at this point, most people are pretty familiar with the severity of the opioid epidemic. Of course, it is a big, complex, kind of nuanced problem. And as the director of our inpatient nursing units, I really wanted to work with my teams to try and identify what our role as inpatient nurses was in combating the epidemic.
And so what are some of the things that you all are doing here?
One of the things that I'm most excited to share is this innovative comfort menu that we created for our patients. We did kind of a brief review of the literature and looked at some non-pharmacologic solutions for pain that we could really own from a nursing perspective. We collaborated with our marketing department to make these beautiful menus in English and in Spanish, and the menus themselves have a series of non-pharmacologic interventions for pain that our patients can choose from.
So could you give us some of the examples that you all are using?
Sure. Some things are as simple as like a warm or cool washcloth. We have some different aromatherapy options for our patients, stress balls, Theracanes, and we also have things to just kind of enhance their environment. We can reposition our patients, add some pillows or wedges, or we could take our patients outside and let them spend some time in nature.
So what kind of results are you seeing by doing this?
I'm most excited to share the results. Since rolling out our comfort menu about 1.5 years ago, we've seen a reduction in utilization for 3 of our kind of top 3 oral pain medications, Norco, Percocet, and Tramadol. And of course, I'm not able to kind of definitively determine causation related to the comfort menu, but we've certainly seen a correlation between offering this to our patients and that reduction in utilization for those 3 meds.
That's awesome. I've also heard that your team was recently invited to a national conference to speak. Is that right?
Yep, we went to a national conference actually earlier in October and got to present our comfort menu to medical surgical nurses from all across the country, and it was really well received. I think people were excited to see the results and even more excited to kind of understand what we can be doing from a holistic perspective to address the opioid epidemic while patients are still here in the hospital before they ever get kind of out in the community. And I don't know that like a Sudoku puzzle or a word search is necessarily physiologically improving someone's experience of pain, but at least it kind of offers them that distraction. And the comfort menu itself helps our patients feel a little bit more empowered and in control of their situation, while maybe they don't feel like they have control of a lot of other things while they're here, at the hospital.
Well, thank you so much for taking some time to talk to us a little bit today, and we really appreciate everything that you all are doing for the community.
My pleasure. Thanks, Kirsten.